Hey everyone! Overwhelmed by Medicare mail? Worried about making a mistake that might cost you for life? You're in the right place. Welcome to Senior Life Discovery with Donna Stansel. On today's episode, independent agent Natalie Rubenstein breaks down the step-by-step roadmap to a stress-free Medicare transition. Learn why starting 6 months early is critical, how to plug dangerous coverage gaps, and how to get expert guidance at absolutely zero cost to you. Your roadmap to a safe retirement starts right here. Here's Donna and Natalie.
Hello, everyone, and welcome back to Senior Life Discovery, the podcast where we are hoping to make your life a lot better as a senior. You know, retiring and turning 65 is supposed to be a major milestone worth creating. But for many seniors, that milestone comes with a mountain of stress, confusion, and a mailbox full of junk mail. I'm talking about Medicare. Having spent years myself working in the healthcare insurance space myself before retiring, I know firsthand just how treacherous navigating these waters can be if you try to do it alone and miss something along the way. Making a single wrong choice when you first sign up can lock you into lifetime premium penalties, or leave you exposed to devastating out-of-pocket costs for years to come. The good news is you don't have to do this by yourself. Joining us today to map out the exact path to a stress-free transition is Natalie Rubenstein. And Natalie, along with her husband, run a highly respected independent health insurance agency based out of Chicago, serving seniors across Illinois, Wisconsin, Indiana, Ohio, Missouri, Minnesota, Florida, and Texas. Natalie, let's start with the hard truth. A lot of folks turning 65 think, I'm smart. I can go to the government website, click a few buttons, and handle my own Medicare enrollment. From your daily experience, why is taking a pure do-it-yourself approach to Medicare such a massive gamble?
Yeah, thank you so much for having me. I think the major gamble is that there's so many choices, so it's really easy to get overwhelmed. And what we see is that a lot of people who tend to get overwhelmed just say, okay, I'm going with the person who sent me the most mail, or I'm going with, whoever calls me first. And the problem is that the government does not make it very easy to switch plans. So if you make one mistake during your initial enrollment period, and choosing a wrong plan, it stays with you typically, for the rest of your life. And so it's really something that you want to be educated about, and make sure that you work with someone to figure out.
Well, that's a critical point, Natalie, and I want to pause on something that trips up almost everyone. A lot of seniors avoid calling an expert because they assume a professional consultation is going to cost them an expensive fee out of their own pocket. Let's set that record straight right now for our viewers. What does it actually cost someone to use your agency's guidance to set up Medicare?
Right. So it is illegal for me to charge anything for my services. So no one has to pay when they work with a licensed agent. The number one question we get is, how do we make money? And we get paid by the insurance agencies to service their business. So you pay us nothing. We get paid from the insurance carriers. Typically, a follow-up question that I get is, well, are you just going to put me in whatever plan makes you the most commission? No, that's just not how my husband and I and our company work. Our allegiance is really to our clients. It's not to the insurance companies. So we will help determine whatever plan makes sense for you. And we don't typically tell people what plans they're going to go in. We offer them education and then let them choose whatever plan they want.
Well, even though you are licensed in all those states I mentioned in the introduction, you can still put people living in other states in touch with experts in their own state to help too, correct?
Correct. Yeah. So we work with a lot of agents across the nation. My husband actually got into the business and had a mentor in Hawaii. So we span the 50 states.
Wonderful.
Yeah.
So, one of the biggest mistakes I see people make is waiting until the actual month they turn 65 to start looking at their choices. Is in reality, a proper secure setup requires a real runway. So,
hmm
can you walk us through why people need to start this process roughly 6 months before their birthday? For instance, 6 months to 4 months out, 3 months out, 1 month out. And can you go over how that really works for them to make it to their best advantage?
Sure. So I always tell people, one, don't stress about Medicare because I can take it all on for you. So as soon as the mail starts coming, people tend to freak out. 6 months out is the best time to talk to people because one, we want to, if you're coming from employer insurance, we want to make sure that we have a timeline that there's no lapse in your coverage.
Good point.
Two, yeah, two, another item is that um, you can start applying for Medicare 3 months prior to the month that you turn 65. So if you turn 65 in July, you had June, May, and April. April 1st would have been the first day that you could have applied. And I always tell people I've seen it take a day to get your Medicare approved, and I've seen it take 3 months. It just depends on Social Security's backup. Um,
So, what? Oh, go ahead. Finish.
I was going to say,
Go
and
ahead.
like recently, like, in the last year, government shutdowns, things like that are all going to affect how fast things get processed.
Yeah. One of the things that I remember thinking when I was a lot younger, turning 65, was I thought I've been paying into this Medicare plan for all of my life.
hmm
And it's going to be free healthcare. So, isn't there a monthly premium involved with Part B coverage with Medicare?
Yeah. So what you're talking about, what you're kind of paying into is the Part A premium. Um, and that's your in-hospital coverage. Part B is going to be your doctors and medical insurance. And everyone who is on Medicare pays that. For 2026, it's 202.90. So, um,
That's for this year only so far, right?
right, right. That's for 2026. It will go up in 2027, just like everything in the world is going up. But um, in 2026, it's 202.90. And the supplements also have a price. So if you're interested in a supplement versus an advantage plan, um, those also have a cost associated with them too. A little
So,
asterisk
okay.
that I'll put, sorry, real quick, is for the Part B premium. If you are what they call a high income earner, they can add an IRMA amount, which stands for income related monthly adjustment amount.
Okay. Um, so if a person is turning 65 and maybe they're still working and they're on their healthcare coverage later into their life,
hmm
how would that work with covering them when they turn 65 or whether they wait for that Part B?
Right. And that's another really big misconception that people have is like, I'm turning 65, I have to apply, otherwise I'm going to be penalized. You will not be penalized if you have credible coverage, and credible coverage includes employee insurance. So if you work for an employer that has over 20 employees, you can remain on that insurance. And just going back to the timeline we were talking about, let's say you decide you're going to retire at 67 and we're talking 6 months out. You need a employer form that states that you delayed your Medicare coverage because you've had credible coverage. So that's something you want to get ahead of and not wait until that last month, because some employers, it could take a few weeks for them to get you that form back.
Okay. So whenever you start taking your Part B coverage, um, if a person is already on Social Security, um, it can be taken out of their Social Security check. But if you're not on
Correct.
Social Security check, you have to pay that premium on your own. Is that right?
That's correct. And Social Security usually does, they send out the first bill, and it's usually for 3 or 4 months.
Okay. So let's talk about what happens after you get standard Medicare sorted out. Original
Hmm.
Medicare covers a lot, but it has some severe structural gaps to it. It doesn't cover routine dental or vision care. It doesn't include prescription or drug coverage by default. And most critically, Original Medicare has no maximum out of pocket. Having an expert guide you through everything includes making sure your doctors are in the plan that you get, and that includes dentists and specialists and vision people. And can you tell us a lot about that?
Yes. So, Original Medicare A and B, they cover you at 20%, or sorry, at 80%. So, you need something to cover you for the additional 20. There's two routes that you can go. The first route is you can get a supplement insurance that covers you for the additional 20 with a Part D plan. Part D is prescription medications. That's one route. Supplements, you're going to be paying a monthly premium for them, as well as the Part D. Now, with a supplement plan, once you hit your deductible of $283, that's for 2026. You don't pay anything else out of pocket if you have Plan G and N.
Okay.
Plan F is not available anymore. Um, on the flip side of that, you can do a Medicare Advantage plan. The Medicare Advantage plans, they replace original Medicare, and they're really all encompassing plans. So they cover you for inpatient, outpatient, prescription drug coverage, and then most of them have some type of benefit for dental, vision, and hearing.
Okay. If a catastrophic if a catastrophic illness hits, that's 20% co-insurance gap can easily consume a senior's entire nest egg. How do you help your clients evaluate supplement plans to plug these dangerous financial holes? Um, what do you what and isn't is there the supplement plans, are they rated? How
Yeah,
they
so
the premiums?
they're attained aged, and they're also community rated as well. So with a supplement plan, you won't get into catastrophic. You could go through a few different events. Um, and after you've hit your deductible of the $283, then your insurance will start to kick in. With Plan G and Plan N, which are the two that we recommend the highest, you won't have any out of pocket expenses. We used to see a lot of catastrophic coverage with the Part D plan. So they would call it like the donut hole. As of, I believe, 2 years ago, they did get rid of that
Isn't that prescription related, right?
prescription. Yeah. So that's where you
Oh,
would really talk about like catastrophic coverage.
so they've gotten rid of the donut hole. That's really nice to
Yeah.
hear.
It's really nice, especially for people who are on like medications that are very costly. You won't pay more than $2,100 in 2026 for your medication. So people who, you know, are taking life-changing medications, um, it's been really helpful for them.
So we've gone down the Medicare supplement target. So isn't there something called Medicare Advantage?
Yeah, so Medicare
Eh,
Advantage is the second route.
Okay.
And with Medicare Advantage, typically, now everything I'm saying is going to vary state by state, but typically it is a $0 premium and pay as you go. So it's kind of the polar opposite of a supplement where you're not paying anything up front, but if you go to a doctor's office, you might have a standard copay or a set percentage of your fees that you would need. Medicare Advantage also has networks. So it's important that when you are signing up for a Medicare Advantage plan that you're working with someone who can run all these plans for you. I know in Illinois alone there's over 600 or 60 Medicare Advantage plans. It's very difficult to navigate by yourself.
So, what about all these advertisements on TV that says, call this 800 number and we'll set you up with your Medicare Advantage plan? What are the risks involved with doing that?
The risks involved, I would say, are typically you're working with one insurance carrier, right? So you're calling them and they're just selling you one plan. Um, when you work with an agent or broker like myself, we can really give you choices. We listen to you and understand. So it's more personalized.
Okay, so when you say personalized, what are you going to try to personalize it with? Is it doctors, or can you go into that a little bit?
Yeah. So understanding your doctors, but also understanding what's important to you, right? So, like, if you are under certain financial strains, we can help you there by understanding, okay, this plan has your doctors covered, but the max out of pocket is $10,000, right? If you don't have $10,000 to cover that, maybe we look at some other doctors that you can visit and get you into a different plan that the max out of pocket is only 3,600. That way you're reducing your financial risk. I hear a lot of people too who ask me about customer service. So many people spend hours on the phone with
Yeah.
their billing, with doctors, so they want to know from my perspective who's the best to work with in case they come into a situation where they need to get on the phone and call someone.
Okay. So, you're talking about a maximum out of pocket with
Hmm.
these Medicare Advantage plans. And are there things that they can buy in addition to getting, say, for instance, their free Medicare Advantage plan that would cover that gap in their coverage?
There are certain plans. I know that there's cancer plans that you can purchase. There is catastrophic plans that you can purchase. If that were ever the case, my recommendation would always be, instead of purchasing extra coverage, to just purchase a supplement plan, because the supplement plan will give you one policy with the coverage that you need, as
Okay.
opposed to spending money here and here on different plans.
So, in addition to checking out your doctors, do you also check whether the plans cover their prescription drugs?
Yes,
Because
of
some of them
course.
have really expensive drugs that maybe need help with.
Of course. So we work with our clients. So after we have our first intake call, we send them a form. It's called a scope of appointment. Every agent that you work with should be sending you a scope of appointment. It is a legal document that we need to have by the government. Included in that scope of appointment is a prescription list. We run the prescriptions for our clients. We give them the best plan. It's usually cost, is the number one factor in deciding that. Um, Something else that we do for our clients is every year we are still checking our clients' prescription drug plans. So for the last 2 or 3 years, prescription drug carriers have been cutting ties with agents. So we are no longer paid a commission. Um, we still offer it to our clients every open enrollment to review their drug plan, because we just feel like it really is a disservice to our clients if we cannot help them.
So, if, say, for instance, in their first year on a Medicare Advantage plan,
Hmm.
they decide that they're not getting the kind of care that they want, can they change their carrier from one year to the next?
In a Medicare Advantage plan, they can. Yes. And that is also something anyone who's on a Medicare Advantage plan should work with an agent to review their coverage during October 15th to December 7th, because every year the insurance carriers can change their network of doctors and they change their formularies. So, for instance, in Illinois last year, a major hospital system in the North Shore went out of network with one of the major carriers. And so a lot of people don't want to change their doctors. So we worked with a lot of new clients to run their doctors and run their prescriptions to make sure that they were in plans that covered them the best for the following year.
So I've heard of something like special election periods. Can you
hmm
go into that? What that means to people?
Yeah. So special election periods, they usually revolve around major life events. So if you're moving, so Medicare Advantage plans and Part D plans, they're all zip code based. So if you move outside of your zip code, you have the month prior to moving and the month after moving to change your plan. So that is an example of a special enrollment period. Another special enrollment, an example, there's like 12 of them, but another special enrollment period would be if your Medicare plan is no longer being offered in your zip code. You would be entitled to a special enrollment period so that you could gain coverage, applicable coverage for your zip code.
So if somebody you mentioned before, if somebody has a doctor that has dropped out of a plan that they're using, does that create a special election period for them?
No.
Okay, good to know.
Yeah.
So, is there anything else you'd like to cover for us today? I know that right now I feel like working with an agent is like having a safety net for a client so that they
hmm
don't have to worry about all the details and all the rules and regulations associated with this healthcare system. So,
Right.
I
I
really,
agree. I agree. And I think it's really important to trust who you're working with because there are um, there are call centers that will, be relentless, and sometimes they can sign you up for plans that are not going to be right or specific for your needs. The other thing that I would say is, talk to your friends, see if they have a referral from you for you, someone that you know and can trust. The last point that I'll say, and I've been working on more and more cases of this, is individuals who are suffering from memory loss, protecting them against Medicare scams because they are obviously targets for call centers. And so they'll put them into plans that are not right for them. And sometimes the power of attorney won't even know until they get to the doctor's office and their coverage is denied. So I have a flyer I'm happy to send you on ways that you can protect your loved ones so that they don't find themselves in these scams. But the number one thing you can do to protect yourself or loved ones with memory care issues is never give your Medicare number to someone that you don't know.
that's a
So,
great idea.
yeah,
So the other thing we talked about special election periods, and even though open enrollment is just from October to December, even into January, we're getting all these ads on TV. And how important is it for people not to fall for that whole idea that open enrollment is over, and yet they're advertising in a big way?
yeah, great question. So there is a enrollment period for Medicare Advantage that does go from January to March. Um, Typically, I think it would be best to do everything during the first enrollment period from October 15th to December 7th, because then you're setting yourself up January 1. Your prescriptions are covered in your doctors. But Medicare Advantage beneficiaries still can change their plans from January to March.
And what if they have, say, for instance, they've got an Advantage plan? Can they go back to a supplement if they choose to?
Great question. They can, but they will have to go through underwriting. So after the first year, if you're past the first year of being on an Advantage plan and you decide, you know what, there's been a lot of hidden costs with my Advantage plan, my health isn't where it was when I signed up, you can apply for a supplement, but you'll go through underwriting, and that includes rheumatoid arthritis, stroke, cancer diagnosis. They'll look at your medication. So people who don't even have cancer right now, but are taking medications that often a lot of survivors take, they can deny you coverage.
Well, that's an
So,
important point. It goes back to the beginning of our talk about when
right.
somebody turns 65, they don't have to go through that qualification process, do they?
No. So that initial enrollment period, that's 6 months from when you turn 65, you can our guarantee issue for any insurance plan. So my recommendation is to always start with the best coverage. And if you need to lessen your coverage, you can, because you won't go through underwriting. Gaining coverage is more difficult.
Great to know. Well, Natalie, you've given us an incredible masterclass today. And I think the biggest takeaway for anyone watching this is clear. Don't guess, don't stress, and don't try to navigate this milestone alone, especially when you can have a seasoned professional like yourself step up for zero cost. So if you're turning 65 or helping a parent get ready, reach out to an expert who can look at your picture, your specific picture. To everyone watching at home, take care of your health and protect your nest egg. Natalie, thank you so much for joining us and for the vital work you and your husband are doing to protect our senior community.
Thank you for having me. It was a pleasure.
It was a pleasure for me too.
If you like this episode, go tell somebody.
Thank you for joining me on our journey together today. Be sure to click the like, subscribe, and alert buttons, and I will see you all next time for Senior Life Discovery.
Go tell someone.